Hey everyone, and thank you for joining us for our second episode of the Insurance Informer. Today is March 4th, 2021. We are broadcasting on Facebook, on YouTube, and also you can get the audio version of this podcast on Apple, iTunes, and on the podcast app. Just search Insurance Informer, subscribe, and you'll get this delivered to you every Thursday. Also, if you're not a fan on Facebook page or the Instagram page or the YouTube page, you can just search Floyd C. Petitt Insurance and you'll be able to find these particular pages and watch all the content that we're going to be providing. Today, we're going to be talking about Medicare and all the confusion that is Medicare. It's like an alphabet, Medicare A, B, C, D, and so on. What do you need? What is best for you? It can be a little bit complicated, a little bit confusion, but Jan Petitt is going to be joining us today to talk about what you need when it comes to Medicare. But first, we're going to talk a little bit about what's been going on there. You're past the freeze now. It's warmed up a little bit, and you had a surprise visitor this past few days. Talk about that.
Well, yes, we're up in the 80s again, nearly. Really nice, a little breezy today. Yeah, we had a nice little visitor, Preston, our little grandson, who's turning 1 this month, got to come in for a few days. So it was really enjoyable to get to see him and then just have all 6 grandchildren together.
And you haven't got to see him until now, and he was born this past summer.
He was born last March in 2020. So this is our first time to actually get to hold him and touch him.
And how is that?
Oh, it was wonderful. He's just precious.
How did the other grandkids react to seeing him?
Oh, they enjoyed getting to see him too and play with him.
That's fun. And one of the big reasons they didn't get to come visit is because of COVID and just like staying safe and lots of restrictions in place.
Yes, in Sydney, his mama is a nurse in California, so she was having to work a lot of double shifts and help out with all the COVID patients at the hospital where she works.
And there in Texas, you have lifted some restrictions. The governor lifted restrictions for masks in place in the state of Texas. But what are y'all going to still be doing as far as the office is concerned? Because businesses can have their own particular roles in place.
Well, for right now, we're going to just leave things as is. We're going to still ask people to wear masks. We're still going to have appointment only. We don't have everybody in the office has gotten their vaccine yet. So we kind of want to wait till everybody gets their vaccines and then we'll revisit it and see what we need to do.
And people are still able to like email you and phone calls, and on the website, there's a contact page that can contact you. And y'all are still also doing like Zoom calls or FaceTime calls if people need that.
Yes. And we still have people coming in the office. We just kind of have it by appointment so we can limit how many are actually in the building.
How has it been doing like Zoom calls or FaceTime calls to help people?
It's been fairly easy. Floyd and I are not very technical, and most of the people in the office aren't technical either, but we've done okay.
And again, they can message y'all or give y'all a phone call or email y'all if they have any questions about anything in their insurance or any claims that they need to have handled.
Yes.
Okay, so now we'll get to our topic at hand. We're going to talk about Medicare. And Medicare can kind of be a little bit confusing because for some people, there's Medicare A, B, C, D. It's like a whole alphabet. So kind of just talk about Medicare in general and what it is.
Well, Medicare in general is health insurance, hospitalization insurance for people that are turning 65 and over. There are some people that go on disability or they have end-stage renal disease and they can get Medicare. And Medicare is governed by the Centers for Medicaid and Medicare Services, which is CMS.
And so, like, there are the different types of Medicare. Like, kind of talk about the differences between those. Is there like, there's Medicare and there's A, B, C, and D. And I believe C is like Medicare Advantage, which is a little bit newer. And then you had just general Medicare, which was the original. Like, what are some of the differences between those?
Original Medicare is going to pay 80% of your bills. That's going to leave 20%. So that's where supplements will come in, or Medigap plans that will pick up, a percentage of what Medicare doesn't pay. You have the Advantage plans, which take the place of original Medicare, and you will have all your doctor visits, your prescriptions, everything is included in that. Some of those plans will give you a few little extra benefits, preventive dental, preventive vision. And sometimes that's at a small cost. It's not actually free. It depends on the area you're in. So everything that people see on TV is not totally correct on all those plans. If you use original Medicare and you pick up a supplement, then you also have to pick up a standalone Part D plan for your prescriptions.
And so the prescription Medicare Part D is, you have to have that if you have the original Medicare, or is it for all of them you have to have it?
No, your prescription will be included in your Advantage plans. The government wants everybody when they turn 65 to get a Part D. If you do not get a Part D when you turn 65, the government will penalize you when you get one. They're inexpensive enough now that people could go ahead and get it even if they're not taking any prescriptions. It's wise just to go ahead and get one in place so you don't have to worry about that penalty.
So basically, if you have the original Medicare, you need to get Part D. That's required. If you have the other plans, it's included in that?
Yes. So original Medicare and a Medicare supplement, or Medigap as some people call them, and a Part D would be equal to an Advantage plan.
Okay, so like, what is the process of signing up? You hit a certain age. Can you do it a little bit before or after? Like, what is the process?
So to sign up, if you're within 3 months of turning 65, you can go ahead and sign up. The month of your birthday, you can sign up, or up to 3 months after your birthday. You're going to go to the Social Security website and sign up there. You can call a local office, or you can just call Social Security and get signed up for Medicare.
So that is a process. You have to call them or contact them in some way. It's not an automatic thing.
It will be automatic if you're already drawing your Social Security benefits. If you have not started drawing your Social Security benefits, then you need to sign up. It will not be automatic. Now, some people maybe are on a group plan still. They're still working. They're on a group plan. They can postpone getting Part B. And Part B, you pay for. Your Part A that you get from Medicare, you've been working, you've worked 40 quarters in your lifetime, you don't have to pay for it. If some people are applying for Medicare and they did not work 40 quarters, they're going to have to pay for Part A also. Part B, everybody is paying for it. And Part A is going to be hospitalization. It's going to be paying hospice. It will pay your home health care. The home health care facilities, if you have to stay there, it will help pay on those while you're recouping after surgeries and so forth. So Part A is considered hospitalization insurance. Part B is medical insurance. That's going to take care of your doctors, your testing, your blood work. It will take care of some of the home health. It's going to take care of wheelchairs, walkers, any of those types of things that you may need. But everyone pays Part B. Now on Part B, there is a standard rate, and it's $148.50 this year. It goes up, changes every year. If you make a certain income that's reported on your tax returns, you could pay more than the standard rate because it's going to be based on what you make. It's called IRMA, and they look back 2 years. So it changes every year as you decrease your income.
So it kind of depends, I guess, on what you want to have covered, if you need it covered on choosing a particular plan.
Well, Medicare is going to cover everything. If you get your Part A and your Part B and then pick up a Part D standalone plan, you can pick up the supplement to pick up that 20% that Medicare is not going to pay. Now, the supplements, there are different plans that have different coverages. The most popular right now is going to be Plan G because it will pay everything that Medicare approves, except for a $203 deductible for this year. And so you won't pay anything else. You'll give them your Medicare card, your supplement card, and everything's going to be taken care of after you meet the first $203.
So if you have the original Medicare, you don't have to deal with the Medicare A and B and C. You would just have to get the D. Is that correct?
No, you can pick up the Medicare supplements have A through N plans. So you do have a lot of alphabet here. People most of the time do like to pick up a supplement or Medigap to cover that cost that Medicare is not actually going to pay. So those plans, A to N and stuff, they have different things that they cover, and so people can pick and choose.
Is there something that you recommend to people, since there are all these options, kind of like add-ons, like you were talking about, the hospitalizations or at-home care, that they should or shouldn't get? Like, should they get all of it, or like, what do you recommend?
Most of the time when people come in, they do want to get a supplement to go along with their Medicare. And they also need a Part D. Like I said, if you don't actually get the Part D when you turn 65, you're going to get penalized by the government when you need to get one.
So everyone really needs to get the Part D, I guess, then.
Yeah.
And so, like you were saying, that the Medicare doesn't necessarily handle with like dental or a vision. So those would also be like supplements or extra things that you would need to add on.
If you're going with the original Medicare and a supplement and a Part D, yes, you can buy standalone dental and vision. If you choose to go with an Advantage plan, you won't be using the original Medicare. You'll be using an Advantage plan. It's going to work like your individual plans pretty much. You have a deductible, you have out-of-pocket maxes, you have copays, you will have your prescription benefit in that plan. They do offer some coverage. Some of the companies offer it for free in the plan. Some are going to charge you to add that on there. And then you have a network that you have to stay within. You can only go to certain hospitals and certain doctors. On original Medicare, you can go, whoever takes Medicare, you can go there.
So if you have the medical advantage plan, do you have to get those extra parts like Part A, Part B, Part D, or is that included in the Advantage plan?
In the Advantage plan, it's kind of A, B, and D all rolled together.
Okay, so it seems, for people who might be confused, if you have the original Medicare, Part A and B and D and so on are like supplements to it to help pick up some of the costs that might not be covered. But if you have a medical advantage plan, that pretty much kind of encompasses it all.
It will encompass all of it. You have restrictions on Advantage plans. It's why a lot of people do not like them. Out in West Texas, if you're living in a metroplex, a lot of times they do work really good. You have to go ahead and apply for your Part A and Part B Medicare in order to get an Advantage plan.
And I guess like what you're talking about, the Advantage plan on it working better in some areas or some areas it doesn't. With Medicare, the original Medicare, you're able to go anywhere anywhere in the country, I guess, to get care.
Right. You don't have to worry about a network and it not being covered. Advantage plans, you have to worry about going out of network and not having coverage.
And again, for people in West Texas, that might be a little bit more difficult if you're having to stay in a certain plans in certain areas with the Advantage plan.
We don't have as many doctors and hospitals in networks as you do a metroplex.
So it could also be, depending on where you live, determines on which Medicare is maybe best suited for your needs.
Correct. And it's very individual. You know, people will come in and we kind of go over all their options.
Yeah, I mean, I guess it can be kind of confusing with, like you said, it's Part A, B, C, D goes on to what, like N or something. That it
That's
might
on the
be
supplement. Yes.
it might be confusing to some people
It is very
overall.
confusing for most people.
And then
So
even
if
after
you've got a
hearing
local
this,
agent, you can call us, you can come in, and we can help you go through all of it and figure out what's going to be best for you.
and I guess that's kind of like we talked about last week in the first episode, is that you like educating people and making sure that they understand their plans. And so this would be specific issue that maybe they're being able to be helped out a lot more and walk through each step of the way of what is needed, what is not, and what this means and what this doesn't mean.
Correct.
So about how much will it cost somebody for the original Medicare or the Advantage plans and some of these add-ons?
Well, the original Medicare, the Part B, is going to cost people $148.50 if they're within the income range. If they make a lot of money, they're going to pay more. A supplement in our area, the Plan G, which is the best plan that you can get, it is running a 65-year-old male about 120 something. Our best plan that we have, females are about 109 a month. And that's the plan that's going to cover everything after you meet the $203 deductible.
Is there a deductible on all these plans and the original, or is it just these?
So original Medicare has a deductible on Part A and Part B. The supplement doesn't have a deductible because it's covering the deductibles, except for the Part B on the Plan G. And some of the other plans cover different things. We just have to look at them. So that's about what that costs. A Part D, I think one of the cheapest plans out there is about $7.30 a month to have the plan. Then you will still have your co-pays for your prescriptions when you pick them up. The premiums on the Part Ds, they go all the way up to $100 a month. Just depends on what kind of prescriptions you take, how many.
Is there anything where people are getting ready to sit down in the next few months to do this that they should be paying attention to when they're getting all set up, or any like warnings to like pay attention to that might confuse
Mostly
people?
what we just tell people is once you apply for your Medicare card and you get it, call us, come to our office, and we're going to walk you through all of it. You're going to get bombarded through the mail when people know you're turning 65. So just call us and come see us. We'll take care of you.
And I guess for people also, it's probably not a usual thing that a Medicare office would call you about wanting your information. So that would
No,
probably be a scam.
that would be a scam. Yes.
So if someone calls you with information like that, don't give it to them, and then probably call y'all and see if that y'all can figure out what may have happened, because you don't want to give people your information over the phone.
Correct. You don't want to ever give anybody your information over the phone.
Is there any other last thing that people should know about Medicare plans that you like letting people know about?
Well, mostly it is very confusing for most people, so it's really best just to come in, sit down with me. We go over everything, make sure that you understand before you leave my office what you're signing up for. I have people come several times until they can understand, what they want to do, because it is a big decision.
And again, I guess even right now with the whole COVID situation, if they don't feel comfortable coming into the office, they can still email you, call you, or FaceTime, Zoom chat with you about this.
Yes.
Okay. Do you have any thoughts on Medicare or anything else that you want to leave people with today?
I know it's confusing, but you will get through it. It will be a good thing once you get signed up and you get going on it.
Okay. Well, I think people learn some things about Medicare. It's kind of like an alphabet. And if you don't understand it, you can always just call y'all and get it all sorted out quick and easy, and they'll be on their way. And thank you again for joining us for this second episode of the Insurance Informer. Again, audio version of this is available on iTunes on the podcast app. Just search Insurance Informer and hit subscribe, and this will be delivered to you every Thursday. Also, if you're on Facebook page, we also have a YouTube page, Instagram. You can search Floyd C. Petitt Insurance, and be sure and follow, like, subscribe on all those particular pages. Lots of content available for you there throughout the week. And of course, this YouTube and Facebook live videos delivered to you every